Hello and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at Celiac.com. And now, let's move on to the latest Celiac.com news. New study finds hidden stomach disorder in 1 in 10 people with celiac disease. This study examines the connection between two autoimmune conditions, celiac disease and autoimmune gastritis, and why their overlap matters. Celiac disease is triggered by gluten and damages the small intestine, leading to nutrient malabsorption and symptoms ranging from digestive issues to fatigue and neurological complaints. Autoimmune gastritis targets the stomach lining, reducing stomach acid and intrinsic factor, and eventually causing iron and vitamin B12 deficiencies. Because both conditions impair nutrient absorption and can lead to anemia, researchers wanted to measure how often they occur together and identify which patients are most at risk. To investigate this, the study analyzed 183 people with confirmed celiac disease. Researchers reviewed each patient's medical history, antibody results, nutrient levels, and the severity of intestinal damage using the Marsh classification system. Autoimmune gastritis was diagnosed through stomach biopsies that showed characteristic inflammation and cell loss. The goal was to determine both the rate of coexistence and whether any clinical clues could help predict who might have both conditions. Of the 183 participants, 19 also had autoimmune gastritis, about 10%, which is significantly higher than in the general population. Two factors strongly predicted this overlap: having Marsh type 2 intestinal changes and lacking anti-endomysial IgA antibodies, which are usually present in active celiac disease. These findings point to a specific subgroup of celiac patients who may be more prone to developing autoimmune gastritis. This matters because autoimmune gastritis often progresses silently, causing vague symptoms that can mask serious problems like iron and B12 deficiency, anemia, and neurological complications. When paired with celiac disease, which already impairs nutrient absorption, the risk of deficiencies becomes even greater. Identifying patients with both conditions allows for earlier monitoring, correction of nutrient imbalances, and prevention of long-term complications. Based on the results, the authors recommend screening for autoimmune gastritis in celiac patients who show Marsh type 2 changes or who do not test positive for anti-endomysial antibodies. Screening may include blood tests for stomach-specific antibodies and, when needed, endoscopy with biopsy. Early detection helps restore nutrient levels, improve energy, and prevent further tissue damage. The study also highlights broader autoimmune connections. Both diseases involve an immune system that mistakenly attacks the body's own tissues, either in response to gluten or directly against stomach cells. Their coexistence suggests a general predisposition toward autoimmune disorders and reinforces the need for a comprehensive approach to patient care. For people with celiac disease, these findings offer insight into lingering symptoms such as fatigue or anemia. Even after adopting a gluten-free diet, autoimmune gastritis may be an overlooked contributor. Regular monitoring of iron, B12, and folate levels, along with coordinated care from gastroenterologists and dietitians, can significantly improve long-term health. In conclusion, autoimmune gastritis affects roughly 1 in 10 people with celiac disease, especially those with moderate intestinal damage and those lacking typical celiac antibodies. Screening, early treatment, and continued follow-up are essential for preventing nutrient deficiencies and improving quality of life for patients managing both conditions. To get the latest celiac disease news and information, be sure to subscribe to Celiac.com news. Thank you for tuning in, and see you next time.